Can I first start by saying thank you to Cancer Council Western Australia, not only for bringing me across, but helping to put this really important issue on the agenda. Because what I want to stress with this presentation, this is very early days, first cab off the rank. I'm hoping, as I said on the media this morning, I'll come back in 20 years and they'll say, whoa, look where we've gone. So you're all part of the send-off. Okay. There's what I want to stress with this slide is it's a big issue that affects a lot of people. 1 in 2 males and 1 in 3 females are diagnosed with cancer in their lifetime. 40% of those are working age, so that puts a lot of cases out there per year. And on top of that, we need to really celebrate and applaud the work of the health professionals, the doctors, the nurses, the allied health, because the progress we're making in cancer is really quite stunning. In a lot of the areas I work in, cancer's gone from an acute condition to a chronic condition, and if you've got something like Hodgkin's lymphoma, you're looking at cure rates. So we really are talking different today than even 20 years ago. And all those people are living longer and are many of them are in the workforce. So the first thing I'd like to say is that the issue of return to work at a social level has major productivity and economic implications. It's at 2 levels. Okay? You'd think because of that it'd be an easily funded area and we'd have lots of information, but actually we don't. It's quite limited in research that's been done. There's been a lot of work done overseas, particularly USA, Canada, Europe and Korea, but we can't just transplant that to Australia because there's a whole lot of variables that wouldn't translate. The work that has been done, and for good reason, is about what happens in the workplace that causes cancer, and we need more of that work as well, but that's not about how we deal with work when we get it. And a lot of the work is in particular area groups. There's a lot of funding, say, for breast cancer, so we know more about those conditions than others. It's what I call a deficit literature. It's all about the problems, and I think it should be rejoicing a little bit in the fact that we have so many people that are back in the workforce who, have one of the many conditions that are cancer and are doing well. So I'd like to see the focus on how we help people back in, but also some of the stories of the people that we know that are already in there and making a huge contribution. And so I think we do need to prioritise a lot more work in this area and in a lot more area of topics. The work I'm going to present you today is Australian work. It's taken from a Queensland study on survivorship, and this was funded by the Leukemia Foundation of Queensland. Now, there's many forms of cancer, and I, in all my presentations, don't like to put them all in the one basket because they're all quite different and they have different stories and different implications. The story I'm sharing with you today are people with what we call the hematological malignancies. They're the ones with the bone and the blood cancers. So this is research. You don't need to take that in. What I'm trying to say in that is that's the methodology we used, and basically we covered every territory. It was right throughout Queensland. It was every diagnostic group. It was every regional classification. It was whether they had transplant or not had transplant. We got data saturation. So I feel fairly confident presenting this data to you today because very quickly we found people are saying the same things here, and that's what we call data saturation. And we had a really nice purposive sample of the whole of the state. So it's pretty solid information. Okay, what did we find? We found that there are 3 groups. I constantly get asked about people returning to work, and I keep saying, no, it's more complicated than that. You can't put everyone in the one basket. We found there were 3 quite dominant, distinct group. The first one, where return to work just wasn't an issue. These people had retired, so working was an issue. Now, here I am. One thing I want to really make clear, today I'm talking about returning to work. I'm not talking about financial issues. So you could be in group one, retired, and financial issues could be still a problem. But that's not what I'm looking at today. I'm looking at who gets back into the workforce. So for obvious reason, Group 1 is not a group we need to look at. The second group were they were returned to work successfully. Indeed, many in this group never even left work, and some flexed down to part-time and then over a 2-year period got back into work. So that's a group that I think we need to stop problematise and actually rejoice and get some good information and look at what they're providing to society, and that this investment we're making in terms of treatment is producing good outcomes. The third group are the ones that we are concerned about, and I believe we can do a lot about, really. And this is the group that want to return to work, but there's just really huge barriers, and I'll talk about those barriers in a minute. With this group that are a retired group that we're not concerned about, 70% of the individuals with cancer are actually over the age of 60 years of age. So you can see a large group of the people with cancer, the work isn't an issue, but that's large in percentage. When we talk about numbers, the numbers of people it impacts on, it is significant. Okay, the next group are the ones who are motivated to return to work. Work means a lot to them, and they do manage to continue or get back in. Some, continue with the same positions, and some re-enter. I've had a sore throat, so I'm going to be very gentle on my... some feel sufficiently recovered to get back in there full-time, and others go part-time and over a period may increase their hours. There's research that shows, and this isn't necessarily Australian research, but it shows that people re-enter within the 1 to 2 years. So when I'm talking about they re-enter, it doesn't necessarily mean as soon as they finish treatment they're back in the workforce. It may take them 2 years to get back in. And some research, again, we haven't got a lot of Australian research, but shows that up to 67% continue. So we're looking at, a group that really are substantially in there with work. How did they get back into work, and how does what supports do they need for there? The loud message that came out of our research was the support from the employers that were really helping this group back into the workforce. The sort of assistance was, above all, flexibility to the hours that they work. The provision of time off for treatment, the availability of part-time work, keeping positions open for people when they're well enough to come back, loyalty to long-term employees, flexibility in the type of work they do. For example, that job in our firm doesn't suit you anymore, but we can move you across to another job. And underpinning all of that is that sense of respect and compassion and care about the people that they work with. So they're big factors from the employers that help people back into the workforce. I'm a qualitative worker and I love my participants. I'm just this conduit that tells you what they told me. I don't mediate at all. So you'll get lots of what they said. So you get a real sense of what they're saying. There is some struggle and compromise. I'm not saying people back at work it's all easy. Some of them still have side effects and things they're dealing with. But if you listen to what they're saying, they want to be back in that workforce. Yes, I love it. Yeah, I've been back there for about 4.5 months now. It was a good thing. There were 984, and he counted them apparently, bricks in the motel we were in during treatment, and how bored we got. So he was so glad to be back in. The director of the centre had been very good to me. Once I was diagnosed, I couldn't do full-time work anymore. He found projects required whatever I could do. It's been very flexible for me. I mean, I feel very blessed in that regard. So here the goodwill, the sense of support that's there. And a sense of gratitude. My employer is super supportive. I've been shown great respect by the company. So you can hear with people that there's more going on than economic rationalism, that there is a connection and a sense of gratitude to workers who do, employers who do that. But we have group number 3, and this is the group I suppose I am concerned about. This group, one of the big barriers for them are the late effects of treatment and and of the disease. The most significant one is the cancer-related fatigue. That can be profound and often takes people by surprise because we all think we know fatigue. I'm a mother of 4. I reckon I know fatigue. But cancer-related fatigue is quite profound. That can really be a huge obstacle for returning. There can be just a wash of other, pain, sleep disorders, digestive problems, graft-versus-host disease, a raft of other physical problems that can make that return quite difficult. The work they're doing may no longer be suitable. The example I get is some drugs cause sun sensitivity. You've got to be very careful of sun. So if you're a labourer or a landscaper or something, that's not a good option to go back into. And if you're having fatigue, the physical work will get you. So it can also just be a mismatch. Whereas if your work is, office space, maybe that's easier to deal with those conditions. Certainly the international research says that those who go back with cancer have more physical problems than those who don't have cancer. And those who don't go back have even more than the ones who go back. So in other words, depending on the level of your physical disability from the disease and treatment will really impact whether you get back into that workforce or not. So it's issues beyond the control of the individual. And that's a message we need people to know. Some people, I've told you the good news about employers. We didn't always hear good stories, and some of them are quite sobering. So some people did suffer the shock of termination, and that can be a life crisis. That's a start again, and particularly hard if you're in midlife or, in your 50s or something. Where do you start? We need people to know that we understand that is hard, because if you haven't come to that journey before, it could be harder than people, understand. And it becomes quite challenging to find out, well, where am I going to fit in now? What job can I do? The estimates, and again, these are not all Australian literature because we just don't have it, but internationally, 10 to 38% do not return. It's a big loss that I think, and for the individual as well. I'm not going to bore you with legal, and I'm not a lawyer, but I do need to flag with you that there are legal parameters to this whole discussion that we're having, that people cannot, and this is Western Australian legislation, that people cannot be discriminated against because they have a disability, and cancer and a lot of cancer-related issues do tick those illness conditions, impact cognitive problems, functioning of the body. So you can't be discriminated on that unless the quality of your work isn't coming up too. But that's a really important one. So when we're talking termination of employment, one of the proactive things we can do is, and that I know a lot of the organisations that I'll talk to you about is referring people to legal aid so that they do know what their rights are. And I think it's important that we do know those rights. And you can't even be asked information about your illness, information that another person who didn't have it would be asked. That's not kosher either in terms of the legislation. So you don't have to put your illness out there unless they're, for obvious reasons, like you had some infectious disease and you're about to work in an infectious ward. Well, that's a cause and effect. But you can't be discriminated for no reason because of your illness. And I think that's important to know. The important message I want to the individual, though, I mean, a lot of that is society and what we should be doing and what we're losing from it. But the important message I'd like to send to the individual facing these issues is that we do know it's a really dramatic psychosocial impact. It has a dramatic impact on the individual. For some people, it's just as difficult as dealing with cancer itself. It can impact on a person's sense of confidence and their sense of competence. And it can rob people of meaningful social relationships. You know, one thing we get out of work is we meet, you know, I've met some lovely people over the last few days, that you get to meet people and you can create your network. And when that's withdrawn, that can leave a void and can leave some people with a sense of uselessness or meaninglessness. And for a subgroup, that can translate into anxiety and depression. So for the individual, it can be a major issue. I haven't emphasised here the financial impact because that's very different, but it goes without saying. The ones that really worried me in the research, and I did a 5-year longitudinal study in childhood leukaemia, and there was definitely a poverty trap in there, is our young families. I think we've got to be really, really careful helping those young families. That's a quote from a young man who, you know, he cried telling me that because to him that loss of income, it was having a profound effect on him and his family. So I don't want to dismiss the financial impact, but that is a more complicated story as well. So, okay, that's the story. What do we do about it? And what's the way forward? We need these work issues on the agenda. We need to start talking about them. So thank you, Cancer Council Western Australia. I think we are. And certainly the media's pick it up. So we are starting to put it on the agenda and start thinking about it. People going through this experience just require knowledge. You know, most people, until you come into an experience like that, you don't know what's out there until you think, oh, where do I go? You know, where they go for assistance, where they go for vocational guidance, where they go for retraining. Most people just have a void there and they need to touch base with people who either have that knowledge or can refer them on. There's a lot that supportive care workers can do. There's either, and I've done a bit of networking, either what supportive care does is have people on board who can give vocational assistance or know who to refer them to, because people do need that expertise, and it is people who are vocational guidance officers. They need some counselling to say, look, you're not alone, it's as bad as you think it is, but we can do something about it. One issue I'm working with the Leukaemia Foundation with is developing a database of organisations that are people that are the type of employers that I spoke of first, who will work with patients who have been diagnosed with cancer. Excuse me. Information for retraining, that's a biggie. More study grants and scholarships, and linked to volunteer work as well, for those who don't want to go back into paid employment. That's the details for the local assistance provided by the Cancer Council Western Australia, who are providing those sort of services. Excuse me. And equally, the Leukaemia Foundation of Western Australia. I mean, there's other groups like Solaris Care. You've got a lot of good things happening over here in Western Australia. Excuse me, I have a publication which, that's very academic. You can get it if you want, if there's any professionals in the group. So thank you for listening. That's what the research is telling us about this area. Thank you.